Thank you, Mr President. It's no surprise, given I have a similar bill on the notice paper and have also called for workers' compensation presumptive arrangements under our return to work scheme, that the Greens will be supporting this bill today. Indeed, I must again pay tribute to my colleague David Shoebridge in the New South Wales Parliament, who took a standalone bill to the New South Wales Parliament, very similar to that I brought here. And indeed, as the Honourable Rob Lucas was railing against the impact that my other bill would have, how the sky would fall in this state should we actually afford workers not just some kind words and sweet niceties and platitudes, but indeed proper cover should they contract coronavirus under this pandemic, or indeed putting them in harm's way and then not supporting them to be able to continue to live, but in fact force them into presenteeism, further endangering not just themselves but of course those around them. As the Honourable Rob Lucas cited business advocate after business advocate about how this would be the most terrible thing to do to South Australia's economy and industry, at that very same time the New South Wales Parliament was passing the Greens amendment to a government piece of legislation to enact those very measures that the Honourable Rob Lucas claimed would make the sky fall in this state. I note that while it possibly has rained in the last few weeks in New South Wales, the sky remains intact, but that the Liberal government of New South Wales supported those Greens provisions to ensure COVID care under their workers' compensation scheme for prescribed workers and in certainly in people-facing industries. And it was not only, of course, the Liberal government that supported that, and indeed I think the Minister for Small Business there in that state that wholeheartedly thanked the Honourable David Shoebridge for putting that item on the agenda, and the Labor opposition, of course, unsurprisingly supported it. But actually every single member of that upper house supported these provisions that we discuss here today. I note in that the Marshall government therefore stands in stark contrast to the Berejiklian government on care for workers under the COVID pandemic. Workers in these people-facing industries who have suddenly been put in precarious and dangerous positions through the very nature of the virus and the nature of their work. The Greens stand by workers, and we also stand by public health provisions that ensure we're not supporting and pushing people into presenteeism. Sick people under this pandemic should not be turning up to work, and we should be ensuring the protections that they need not to do so. Should somebody contract coronavirus and die, we should be giving them supports. We know in the UK, I think it was a bus driver, has died from this disease and has been left completely unsupported, and yet we're putting people in harm's way with a virus we don't yet fully understand, but we know is contracted through that contact that we are forcing particularly people in what are now known as essential industries to undertake each and every day. Of course, essential industries are traditionally seen as those such as health and emergency services and policing, but essential industries, we have quickly learned in the last 2 months, are the provision of food and services, the provision of those goods and services and activities that allow us to stay home if we're not in those industries, that allow us to stay safe and do not allow them necessarily to have that same safety and security. I think, given these provisions are actually available to all workers, it is simply that we are making it less onerous upon them to take advantage of the workers' compensation scheme by changing that presumptive relationship and recognising that rather than these particular workers staying home, staying safe, but they are indeed having to go to work and be in harm's way to keep our society going, that we should, at the very least, change the rules around that presumption. Given we're putting them in these positions, we are putting them in danger, we owe them the absolute respect of ensuring where they do get sick, we protect them. Where they're in danger and have symptoms of being sick, that we protect them, and we protect ourselves by doing so. Certainly to not afford what I've called COVID care is cutting off our noses to spite our faces. We want people to stay safe under the pandemic, but if we're not going to provide the protections that people need, we're going to see presenteeism, we're going to see people put in danger and make that choice, perhaps not to turn up to work, or indeed to turn up to work and possibly make others sick, unless we provide this presumptive treatment under this pandemic. The Greens have noted that the Labor opposition prefer their bill to the Greens' bill. I note the amendments that have been filed, not just by the opposition, which are largely clerical and administrative in nature, but the Honourable Connie Benares has filed amendments in terms of the prescribed workplace definitions and also the inclusion of disability, and the Greens will be supporting those, as well as that of the facility not being private residence at which residential accommodation, respite care and other supports and services are provided to people with a disability. The Greens have also today lodged amendments that reflect some of our bill, the bill that the Labor opposition didn't prefer. I note one of the issues I raised in the previous debate was a commencement date. The Greens have reissued our commencement date that sees this presumptive COVID care, seen retrospectively back to March the 15th. We also have noted that the Labor approach has been to define workplaces rather than an extensive series of workers. I note that this approach with healthcare workers hasn't prescribed those particular workers as a class, but has instead prescribed their place of work. That being defined as a hospital or a day surgery premises or a pharmacy, I believe actually excludes many healthcare workers, and certainly I asked the Labor opposition to explain whether or not GPs are covered under their bill, because most GPs don't work in hospitals, in pharmacies or where day surgery is performed, whether a range of nurses are covered under their bill, particularly those who work in community clinics, and in particular of greatest concern right now is whether or not the COVID clinics themselves, if they're not in a hospital premises, are covered by the Labor Party legislation. I note that with short time frame I have contacted a range of the health services union, specifically HSU, but also the ANMF, the AMA and the salaried medical officers unions. Certainly from the ANMF, they have welcomed the Greens amendment to the Labor opposition bill. I note that it would be out of order for me to comment necessarily on committee evidence, but I'm sure it was reported in the media somewhere, Mr President, that SASMOA wrote very early on in the pandemic to the Treasurer via the Premier that they were seeking to be covered by a presumptive treatment under the Return to Work Act for their workers, their frontline medical doctors and nurses and salaried medical staff to be covered under the pandemic by this treatment. Their correspondence, I understand, Mr President, continues to remain unanswered and unresponded to by the government, and I note was strangely absent from the Treasurer's contribution to my bill. I'm hoping that he will remedy that today with his response to SASMOA's request for just the sort of COVID care that we're talking about supporting today. With that, I do look forward to the committee stages of the debate. I remind the Marshall ministers that they are out of step with their New South Wales counterparts. I also remind them that this does not actually create a new entitlement. It does, however, reduce the blue tape that is being put in their way to access this COVID care under our workers' compensation scheme. And whether it's green tape, red tape, or in this case blue tape, I thought simplification and protection of workers is what we were all here for under this pandemic. So with those remarks, I commend the bill to the Council.